Varicose veins or spider veins come in all shapes, sizes and colours. Now you may not have one yet, but there's a 1 in 5 chance that any of us could get one in the future. Now the question is, are they bad for you? Should you be worried about them? What can you do to help with them? What can you do to prevent you from getting them in the first place? And when should you seek medical advice for them? Well, I'm going to answer all of them questions in this week's video. Now, before we begin, let's first learn a little about varicose veins, because you might not know what these are. So in short, varicose veins, most people tend to find them on the back of their legs, the back of their knees, their calves, their ankles, and they appear as small lines which are red, bluey, purple in colour, and when you press on them, they usually don't go, so they don't disappear when you press on them. Now with time, these varicose veins can get thicker, they can bulge out a little more, and it can give the skin an appearance of lumping, like a lumpy appearance to the skin. So the next question is, well, what causes these varicose veins? Well, the explanation is quite simple. So in our veins, we have these valves, like so, and they open and close, and they prevent the blood from flowing backwards the wrong way. Now as we get older, our veins become less elastic, the muscle gets thinner, and these valves don't work as well. So this then results in them valves not working properly, not closing properly, and the blood flowing and getting stuck on the wrong part. So by getting stuck at the wrong part, it causes that bulging that we're all aware of that you get with varicose veins. And unfortunately, once it's happened, it can't snap back into place. Now, one way to imagine it, I always say, is imagine a balloon. Okay, you've blown a balloon up really, really big, and after a while, the air comes out, but it never goes back to what it first was, the size and the shape it first was. It always stays a bit stretched. So imagine a vein like so. So that bulging and that blood forming behind the valve causes the balloon to grow, so the vein to grow, and then if it goes as well, it never goes back to its original size and shape. This is one of the reasons why sitting for long periods can make the blood pool and put you at a higher risk of getting varicose veins. So we're going to talk about that a little later as well. Now, in addition to this, there are various other factors that put you at a higher risk of getting varicose veins as well. Unfortunately, females are more likely than males to get varicose veins in the future. Another cause as well is pregnancy. So women who have been pregnant again are at a higher risk of eventually developing varicose veins. Another factor to mention is being overweight. If you're overweight, you're going to be at a higher risk of getting varicose veins. And also, if you have high blood pressure which isn't controlled, so your blood pressure is high, it's not controlled, you're not taking medication for it, and it's not being controlled, you're going to be at a high risk of getting those varicose veins. Also to mention, abnormal blood vessels. Some people have abnormal blood vessels, which puts them at a higher risk of getting varicose veins. And lastly, there is a genetic link as well. If some of your family members have it, you are probably going to be at a higher chance of getting varicose veins in the future. But saying all of this, the good news is that varicose veins are usually nothing to worry about, and there's many things that you can do to help treat it and to help prevent it from happening in the first place. Now that we're done with all that scientific stuff, let's move on to the treatments and preventative stuff. So the first thing that we can all do to try and treat varicose veins is to lose weight. Look, if you are overweight, you are going to be at a much higher risk of getting varicose veins or having varicose veins. So the best thing that I would recommend to everyone is to check your BMI if you haven't already. I'm going to leave a link to a BMI calculator in the description below. It's really easy to use. You just pop your gender in, you put your weight in, you put your height in, and it calculates your BMI and tells you what your weight status is. If it's normal, then great. If you are overweight, then please do consider trying to lose weight. All of that excess weight isn't going to help with those valves that we spoke about earlier, and it's going to put you at a higher risk of getting varicose veins, or if you already have them, it's going to make them worse as well. So you need to try and lose weight if you are overweight. Now, the next thing I want to discuss as well is I do have quite a videos on how to lose weight. If you are interested in losing weight, these videos have had over 12 million views, I think, and it's all on studies based in Oxford on scientific approaches on losing weight. They're really simple to follow, so if you are interested in learning how to lose weight, and if you do need to lose weight, please feel free to click on that link up there or in the description below. Moving on to the next tip. For almost instant relief, try elevating those legs. Look, you know the background of why varicose veins happen. You now know all about the valves. If you're going to be sat down for long periods, you need to try and elevate those legs. Lift them up as high as you can to try and get that blood to go backwards, so it's not getting stuck behind those valves like we spoke about earlier. This is going to make a massive difference on those varicose veins if you currently have them, or if we're trying to prevent them. Which moves us on nicely to the next point I want to discuss. Look, if you're doing those leg raises, if you're keeping your legs raised, try doing some simple stretches as well. One of the most simple stretches you can do, I don't have a towel unfortunately, but if you had a towel and you had your leg sort of raised, I'm trying to get it in the shot, get the towel over your leg like so and pull. That way it's going to stretch the calf muscles and it's going to help move that blood, it's going to help circulate that blood and help you to prevent getting varicose veins and help with the symptoms of varicose veins at the moment. Now another point that I'd like to discuss is exercise. If you can do exercise on a daily basis, at least 20 to 30 minutes a day, this is going to be fantastic for your varicose veins or helping to prevent them from happening in the first place. We need to be doing things like leg exercises, such as running, such as jogging, strength training as well that involves the legs. All of these are really, really good to get that blood flowing. Now, if you can't do them, if you're going to struggle to do them, it's completely fine. Don't worry about it. Any exercise is good. So if we go swimming, if we do yoga, anything like that is just as good as well. So try and incorporate those into your lifestyle. And if you want more information on exercises and how to live a more healthy lifestyle, I do have a video all about this. It's a 2-part series, and if you're interested in incorporating more of a healthy lifestyle for yourself, from balanced diet to sleeping right, to socializing, to mental clarity, to the exercise, to the stretches, everything that you need to know is in this video that I've done recently. I am going to link it up here and in the description below. If you're interested, I would definitely recommend that you give it a watch. Moving on to the next tip. If you're someone who sits for long periods, then you need to do something about it, because this is going to make those varicose veins worse. It's going to put you at higher risk of getting them as well. So like I said, we need to do the stretches, which we spoke about. We need to lift the legs as well, which we spoke about. But try and get into the habit of getting up and going for a short walk, going for a little 5-minute walk, going up and down some steps. Do something, get some movement in. So always think to yourself, when you sat down for about 10 to 20 minutes, whether you're in the office or the home office, because a lot more people are working from home, think to yourself, have I moved my body yet? Always keep asking yourself that. Maybe write a little note, have you moved your body yet? And that means just get up, go for a quick walk, a 2 to 5 minute walk up and down the steps to get that blood flowing. This is going to make a massive difference because we know all about those valves and how it can pool. We don't want the blood to pool in those valves, behind those valves, which cause that bulging. So we need to get some movement. So I'm going to ask you again, have you moved your body yet? Now the next thing that I'd like to talk about are compression stockings. Compression, we all know, is pressure. Stockings come as stockings or socks, whatever you prefer, and they come in different sizes and colors. So they're really, really helpful for people who already have varicose veins, or if you want to prevent yourself from getting them in the future. So if you've already got them, they can help to stop them from getting worse, or you can wear them to prevent you from getting them in the future if you're worried about it. Now, the best advice I can give for compression stockings is always speak to your healthcare professional about them. That is the best recommendation. Don't go and buy some online because you don't know the size you need, you don't know the compression class that you need. So always have a word with your healthcare professional and they will be able to advise the best stockings, the best compression socks or stockings that are more appropriate for you. Please do speak to your healthcare professional. Don't just go out and buy it. And lastly, if you've got varicose veins and they don't cause you any pain or any problems, but you just don't like the way that you look, unfortunately, there are no treatments that are on the NHS at the moment to get rid of them because this is seen as more of a cosmetic thing, but there are many private healthcare professionals that can help with these, such as injecting a solution that helps dissolve them to get rid of them. There's many different treatment options available. I will leave more information about these in the description below if you are interested to learn more. So now that we've covered varicose veins, what they are, what causes them, how to treat them, how to prevent them, the next thing I want to discuss with you is when to seek medical advice. Look, the most important thing about varicose veins, if you have any pain from them, if they're causing you difficulty to sleep, if they're causing any sort of pain, speak to your healthcare professional so they can find out what is causing the pain. This is the most important thing. Don't just start taking painkillers without speaking to your healthcare professional, because all you're going to be doing is masking those symptoms and there could be something very severe going on. So any sort of pain, speak to your healthcare professional. If your healthcare professional says it's all fine, then do take those painkillers. Paracetamol can be quite helpful, but like I say, always speak to your healthcare professional so they can make sure that it's also safe and suitable for you to use that medication. Now, another point that I'd like to discuss with the varicose veins is if you do have them, get into the habit of checking them daily. Have a look at them daily, make sure they're not changing much, make sure they're not bleeding, because if varicose veins start bleeding, they can cause very deep bleeds and it can be quite difficult to treat. So get into the habit of looking at them regularly, and if there's any changes, again, speak to your healthcare professional about it. And lastly, the main thing I want you all to remember is, one, any sort of pain around the leg region, any sort of unexplained pain that you get, speak to your healthcare professional. Any swelling that you get around the legs and causes any pain, again, speak to your healthcare professional urgently. This is the most important thing that you remember. Any pain or swelling or redness, any of the three, one of the three, speak to your healthcare professional so you can check it out and find out exactly what is going on. Thank you for watching this week's video. You are now a varicose vein pro. You now know all about why they happen, what to do about them, how to treat them, how to prevent them, and when to seek medical advice. If you have any of your own tips, please leave a comment below because I'd love to read them and I'm sure people watching this video will too. And as always remember that you're awesome and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.